Good morning to the board, and we sincerely thank you for the opportunity to speak with you today about the many challenges facing Aboriginal and Torres Strait Islanders in Australian healthcare environments. My name is Hannah, and along with my fellow colleagues Emily and Shania, we trust that by the end of our presentation you will have a greater appreciation for the impact that these challenges have on these minority groups, as well as the need to implement a number of strategies to effect positive changes. To begin, I will discuss the barriers of meeting the holistic health needs of Aboriginal and Torres Strait Islander people. Shania will then elaborate on this by illustrating the benefits of holistic care through Aboriginal community-controlled health services, and Emmy will then conclude with a discussion regarding a key issue of discharge against medical advice, including suggestions of appropriate strategies to reduce incidents of this occurring. I would like to my presentation today by stating the definition of Aboriginal and Torres Strait Islander health according to the National Aboriginal and Torres Strait Islander Health Organisation, being that it is not just the physical well-being of an individual but refers to the social, emotional and cultural well-being of the whole community. Unfortunately, these core themes of social, emotional and cultural well-being are underrepresented in the provision of healthcare to these minority groups throughout Australia. Racism and discrimination through the delivery of health services is a key social barrier. As outlined in 2013 by the National Aboriginal and Torres Strait Islander Health Plan, racism can manifest individually or institutionally as a result of ignorance or ingrained historical practices which remain prevalent within the mainstream healthcare system. For instance, a 2017 report by the Australian Health Ministers Advisory Council stated that in 2008, 26% of Aboriginal and Torres Strait Islander people reported problems at accessing healthcare. This was because of a number of barriers including excessive wait times, a lack of transport or access to healthcare due to distance, unaffordable costs, discomfort and lack of trust with healthcare providers, and cultural and language barriers. These are systemic issues that are present in not only the manner in which healthcare is provided, but also the infrastructure through it is available. Equally as important to consider are the emotional barriers faced with Aboriginal and Torres Strait Islander people, especially by those who live in remote communities. This is due to the limited physical access to available healthcare, which forces those who require treatment to leave their community. As described in 2017 article by Dudgeon, Karma and Bray, the resulting feelings experienced by Indigenous people is a disconnection from their family, kin, community, country, culture, spirituality and ancestry. Ultimately, the many who require healthcare, these are key factors for why they neither seek it or receive it. The final issue I raise today is the cultural barriers that remain prevalent in mainstream healthcare. A 2013 report by Ware illustrated that a high proportion of healthcare practitioners have low expertise in Indigenous health and limited awareness of the history and culture of Aboriginal and Torres Strait Islander people. As a result, the healthcare provided is often culturally inappropriate. As described by Abbott, this lack of expertise impacts the relationship in healthcare providers and limits the ability of those who seek healthcare to receive appropriate treatment. Those social, emotional and cultural barriers that I've raised today are significant and need to be addressed holistically rather than individually. I'm pleased to now introduce Shania, who will discuss the benefits of holistic healthcare through Aboriginal community-controlled health services.
Thank you, Hannah. Good morning. My name is Shania and I am here today to discuss the strengths and relevance of Aboriginal community-controlled health services, ACCHS. Firstly, ACCHS is a primary healthcare service that focuses on delivering holistic, comprehensive and culturally safe healthcare to Aboriginal communities. It is initiated and run by local Aboriginal communities in many metropolitan, remote and rural areas. The National Aboriginal Community Control Health Organisation further defines it as being an incorporated Aboriginal organisation based in a local Aboriginal community, initiated by a local Aboriginal community and governed by an Aboriginal body elected by the local Aboriginal community. Government-controlled organisations are not included, nor are organisations that implement a vertical approach to health rather than a holistic approach. Each ACCHS has 4 fundamental roles, which are the provision of primary clinical care, community support services, special needs programs, and advocacy and policy development. As Hannah previously discussed, it is important to understand that Aboriginal health not only takes into account the physical well-being of an individual, but also the emotional, social, and cultural well-being of the whole community. This enables all individuals to achieve their full potential and raise the total well-being of their community. Aboriginal community-controlled health services are based upon principles of self-determination and strive to uphold ideals of community control, therefore giving individuals the power to achieve their own goals. Throughout Australia, over 150 Aboriginal communities have been allowed control over their healthcare. This concept of community control is particularly important as Aboriginal communities across the country all have a distinct language and culture. The notion of community is also a fundamental part of the Indigenous view of the self. Moreover, enabling Aboriginal communities to control the process of healthcare delivery is a way of reducing health inequalities. Aboriginal community-controlled health services have been highly beneficial for Aboriginal communities. They have been associated with improved health outcomes, particularly in mental and sexual health, chronic disease, and an overall improvement in mortality. Aboriginal community-controlled health services' unique elements facilitate high levels of community participation that is central for providing comprehensive and quality primary healthcare. Their holistic view of healthcare recognises and understands the multifaceted healthcare needs of Indigenous Australians that mainstream health services do not appreciate. It is therefore important that the government acknowledges and continues to support Aboriginal community-controlled health services to better the health and well-being of Aboriginal and Torres Strait Islander people. A wider adoption of the principles by national governing bodies as well as improved financial support will allow Aboriginal community-controlled health services to thrive and lead to better health outcomes. We now have Emmy who will discuss discharge against medical advice.
Okay, thank you. Thank you, Shania. Good morning. My name is Emmy. Today I'm here to discuss discharge against medical advice, DAMA, and strategies to reduce our DAMA rate. DAMA is where a patient self-discharges from the hospital against medical advice. This has enormous implications on health, as self-discharge often ends in multiple readmissions and worsened health outcomes. The Australian Indigenous population has the worst DAMA rates in the world. Our hospital is no exception. Last year, 3.3% of our Indigenous patients self-discharged, compared to only 1% for our non-Indigenous patients. This is a gap that we need to address. So 3 common reasons for Indigenous patients to self-discharge were problem with communication, lack of culturally appropriate care, and isolation from country and family. So I propose to address the first 2 issues by increasing our Indigenous workforce through recruitment and retention strategies. Indigenous healthcare staffs can help improve patient satisfaction by acting as their translator, advocate, and educator for the patients, as well as helping increase the cultural safety of the ward by giving cultural advice to the non-Indigenous staff. In 2009, a hospital in Western Australia succeeded to reduce their Indigenous DAMA rates by half through providing around-the-clock care by Indigenous staff. So, however, recruiting and retaining of the Indigenous staff is an issue that many organizations struggle with. So here are my proposition for recruitment: to create entry-level opportunities such as traineeships and apprenticeships for programs for young Indigenous people, and to periodically visit the local schools and the community to communicate about these career and job opportunities. And third, organize a career fair targeting local students to nurture their interest in the healthcare profession. This will help build a future workforce for us, as well as strengthen the links between our hospital and the local community. So we also need to retain these valuable staff. So the 2 main reasons behind Indigenous staff leaving their jobs were the lack of career pathways, as well as a lack of flexibility in the work arrangements. So I propose to create a professional development program and career mentorship programs, as well as creating a pool of relief staffs that would facilitate the Indigenous staff to take necessary leaves. These strategies do require some investment and commitment from our part. However, I strongly believe that building our Indigenous workforce can increase patient satisfaction and in the long run help reduce our DAMA rates. Thank you very much for your time this morning, and
Thank you.
Thank you.